I suggest every dermatologist should be on social media. Every doctor should be on social media just to kind of counteract the misinformation that is there. If all of us are there giving right information, then people know whom to trust, which source to go to. So just for that reason also, everybody needs to be there.
US
so
has
that-
been very active, doctorly, I guess, Dr.
Yeah.
Mujib.
Yeah.
Right?
So US is very active, and now a good thing about YouTube in US is that they also have that one label that comes that it is from a registered medical practitioner. So they ask for degree and they verify that. And if you have a proper medical degree, if you're a registered medical practitioner with a licensed degree, then that labeling comes when you're making your videos. So then that's a trusted source.
India में
It's
तो
going to
मैम
also start in India.
90% India में 90% brands बंद हो जाएंगे अगर ये label आ गया.
The thing is that there has to be clarity. See, I'm not saying that only dermatologists should talk about skin.
Correct.
You can talk about skincare products if you are using it on a regular basis, not a problem. But you cannot call yourself a skin expert. You cannot be treating one person, that is yourself, for acne, and then acting as an expert in acne and showing medications that are written in your prescription,
You can be
asking
an-
people to use those creams that a dermat has prescribed. That's not
Also,
the right
you
thing
can
to
be
do.
an enthusiast and share your experience, but you
absolutely.
cannot
Share
be
your
an
experience.
expert.
Yeah, share
sharing.
your experience. See, acne can be sometimes a very lonely journey, especially if you are the only person having acne in your friend circle or in your family. Then you can feel a little isolated. You don't know whom to talk to. You don't know how long acne is going to be there on your skin. So of course, having a community definitely helps. So show them how you need to be patient, how you need to do the right thing. Don't avoid using certain things. That's okay. But posing as an expert and treating people's acne, I think it's taking things too far, because there are so many aspects that we need to look at. I also get a lot of queries about, they give me a detailed history and say, now tell me what a routine I can follow. It's not legal for me to give them the information without seeing the patient, without understanding, without checking the quality of their skin, what have they used in the past, what they have not, how their skin type is. Without understanding that, how can I just prescribe medications, right? So that's what I tell my patients, and they'll feel like, oh no, but we just want one cream to make this better, one cream to... No.
I saw this reel on Instagram of this influencer promoting isotretinoin. Just have
that
it.
is so harmful, right? So we as
I
dermatologists
think
are
that
really
must
trying to
be
raise
of,
awareness.
The West now, not
But-
here in India.
No, in India, some Indian.
No, in West it's okay. You know why in
West.
West it's okay? Because there nobody can get isotretinoin without a
Correct. It's a
prescription.
prescribed
There
product.
nobody can get retinoin without a prescription.
There it's
so there
available
you can
everywhere.
even discuss, immunomodulators, chemotherapy drugs. They can discuss that along with side effects. Here we cannot. Here people are just going to go to a chemist and start using the product. So it's so difficult because we have to self-regulate, So I also really have to stop myself from giving out certain information and naming certain products, because I don't want them to be misused. I don't know who's watching my videos. Is it a 12-year-old girl who's watching it? Is it a 16-year-old girl who's watching it? How do I know, right? And these are people who should absolutely not be using anything. Age is not a factor. Something like isotretinoin should never, ever, ever be used without prescription. Okay, and that too, it should be only prescribed by a qualified dermatologist who understands the implications of taking that medication. What other medications you should use with it, not use with it. Know the side effect profile. Know what all evaluations have to be done. So. That's why sometimes I feel, like skin is so trivialized. People take it so lightly, but yet we have to...
They end up losing it all.
And
I
I
saw
think
this
wasting
influencer-
time, coming with
I think
severe
there should
scars.
be, you can just guide the Gen Z people. Why I'm focusing on Gen Z people is because they're very interested in trying new things.
Yeah.
But at the end, it's your skin and your 20, in your
Exactly.
2022.
There's so much a feeling of FOMO when it comes
Correct.
to products. As soon as a new product is launched, everybody wants to try it, and then the next month something else they're onto. No, you have to treat your skin as a long-term investment.
It should
If
be
something,
at least just a CTM to start with for the Gen
just
Z
a
people
simple
to keep
routine.
it simple.
Keep it simple. Use it for regularly. Maybe one dermat visit once in a year, just to know that you're on the right track. If you have acne, of course, then you might have to go a little more regularly. Otherwise, just one visit once in a year, once in 2 years, also just to know you're on track is enough. At least you have the basics in place.
Right.
And then if you want to try a new sunscreen or a moisturizer, face wash, that's okay. But people with sensitive skin who have rosacea, I would suggest don't experiment with your skin.